Welcome to this review of liver focused on anatomy, vasculature, and pathology for the ARDMS Abdomen exam. The liver is an intraperitoneal organ with the exception of the posterior bare area. It is encased in a fibrous layer called Glisson's capsule, and its primary physiological roles include the metabolism of carbs, lipids, and amino acids, as well as synthesis of bile for digestion. We use Couinaud's system to divide the liver into 8 functional segments. This division is based on portal venous and biliary drainage, providing significant surgical utility by allowing for the resection of specific segments without compromising the remaining tissue. A common anatomical variant is a radial lobe, which presents as a tongue-like inferior extension of the right lobe. It is important to recognize this variant so it is not incorrectly identified as hepatomegaly. The key sonographic landmarks include main lobar fissure, which connects the gallbladder neck to the right portal vein and separates the right and left lobes. The ligamentum venosum separates the left lobe from the caudate lobe. And finally, the ligamentum teres is a remnant of the fetal umbilical vein that may recanalize in cases of portal hypertension. The liver has unique blood supply. Portal venous flow is hepatopetal or towards the liver and is identified by bright echogenic walls due to high collagen content. At Porta Hepatis, the hepatic artery is positioned anterior to the portal vein, forming part of the Mickey Mouse sign. The hepatic vein runs intersegmentally between lobes and segments to drain blood into the IVC. This flow is hepatofugal or away from the liver and displays as a triphasic or pulsatile pattern because of its proximity to the right atrium. In diffuse diseases, the fatty metamorphosis appears as an increased echogenicity and attenuation. Controversially, acute hepatitis may present with a starry sky sign characterized by prominent portal triads against a hypoechoic liver. Cirrhosis involves chronic irreversible fibrosis. Sonographic findings include nodular surface, an enlarged caudate lobe, and a shrunken right lobe. Patients are often seen with ascites and face an increased risk for hepatocellular carcinoma. The most common benign tumor is cavernous hemangioma, typically appearing as a small hyperechoic mass. We also see hydatid cyst, which is parasitic in origin and presents with mother-daughter or water lily signs. Hepatocellular carcinoma is primary liver cancer and is associated with elevated alpha-fetoprotein levels. However, liver metastasis from primary sites like the colon or breast is actually more common than primary HCC. To summarize, remember that normal liver is between 13.5 and 15.5 centimeters. Portal flow is hepatopetal, and elevated AFP levels should raise a suspicion for HCC. Cirrhosis can be compared to a smooth sponge turning into a hard, lumpy brick. Let's review. The landmark separating the left and caudate lobe is ligamentum venosum. The starry sky sign indicates acute hepatitis. The most common benign tumor is cavernous hemangioma, and the normal portal flow is always hepatopetal.